Every day, 15,000 Indians turn 60 and become senior citizens in a country that ranks the lowest out of 43 countries on the Natixis Global Retirement Index. India is currently home to about 140 million elderly. Low pensions, meager savings, and a lack of health insurance cover mean that they enter old age with great financial insecurity. There are 90 million elderly in India who are still working for a living. What's more concerning, 1 out of 2 Indians also enter old age with a chronic disease. Not surprising, with every 6th diabetic in the world being an Indian. As the years go by, physical aging with unexpected onset of illnesses like dementia or Alzheimer's makes day-to-day living a nightmare. What makes it more terrifying is living alone. Believe it or not, 3 out of 10 elderly in India live alone or with another senior citizen. Majority of them are women. In most cases, children would have left in search of a better livelihood, either to live in cities or even abroad. In fact, according to an Antara report, 1 out of 2 elderly face mental health issues during the pandemic. You do not know what it's like to be lonely until you spend time alone wishing for companionship, said Ratan Tata recently. Companionship, community and consistent care is what they crave. The neglect on our part needs urgent addressal, and it is being addressed with geriatric care evolving from just running errands for elders to engaging them online and offline with weekly events, reinvigorating their lives with dedicated residential communities, and taking care of their health with assisted living and at-home care. Hello and welcome to Young Turks, India's longest-running show on startups and entrepreneurship. I'm Shireen Bhan. To talk about the importance of expanding the geriatric care space in India, I'm now joined by Tara Singh Bachani, the founder of Antara Senior Care, Saumyajit Roy, co-founder of Imoha Eldercare, and Neil D'Souza, the co-founder of Get Set Up. Tara, Saumyajit and Neil, many thanks for joining us here on CNBC-TV18's Young Turks. Saumyajit and Tara did work together. In fact, Saumyajit was part of the founding team at Antara before he decided to set up Imoha Eldercare. Saumyajit, let's talk about your journey and what you're attempting to do and address through Imoha Eldercare.
No, Shireen, thank you. I think it's an extra special privilege to be part of Tara's team and learn so much from a beautiful dream that Antara got created. My journey in eldercare started about 4 or 5 years before that, when I was heading the senior care vertical at Jones Lang LaSalle, helping a lot of organizations think through their senior living strategy. But I think it's more personal. I think it started with my own mom, my own dad, and seeing the struggles that India's elders face, over the years, and how they're able to manage it from the comfort of their own home. And the word Imoha goes into exactly that. If you turn around the word Imoha, it's a home, and it's the acceptance that India's elders, unlike a lot that has happened in the world, would want to stay in their own home. 99% of India's elders want to stay in their own home. That's what you want to go when you are not well, or you're in a fancy house in Florida. You would finally want to go back to your own home. So how do we stitch, all the services that you would otherwise get in a beautiful, facility, beautiful, continuing care retirement community worldwide? How can you deconstruct all those things and be able to stream it into your own home is what Imoha started to build towards. And therefore, whether it is emergency 24/7 support, where today we save more than 350 lives, or it is doing engagement and events using the Imoha app, where we've done more than 3,000 programs now. The whole idea is that stay in your own home, but benefit from the best of care, which is not compromised. So how do we not reinvent the wheel? There is the nearby hospital, there's a nearby, the care ecosystem is there. But how can we have the digital world, the physical world married together, but a unique concept that we've created at Imoha called Imoha Daughters. With daughters, there is a special privilege because 85% of world care needs happen by the daughter. So at Imoha, we've made the Imoha daughter the fulcrum of care, who hold the whole family together and stream in not just healthcare, but also social, emotional, travel and other support systems into the elders' home. Today, we've got about 30,000 elders across the country now, 80 cities and towns, where elders are staying in their own home and benefiting from the services. But I think more importantly, Shireen, the thing is about how does this, what seems as a challenge, come out as an opportunity? Because that is really the thing between the work that is being done across all large elder care companies in the country. The opportunity is to look at a 40,000, 50,000 crore market where we can make an impact and a difference in the quality of life, as Tara said. that is really the driving factor.
Saumyajit, both of you, Tara, Neil, and yourself, you've all spoken about this being a $15 to $20 billion market opportunity. So, Saumyajit, I want to understand from you, are you now starting to see more investor interest coming in? Because all of these plans are also going to require funding, especially when we talk about scale. So, is that starting to happen? Are you starting to see investors buy into this story, into this opportunity? And secondly, we talked about demand, and that's very clear from what each one of you has said. But on the supply side, especially when we talk about appropriately trained manpower, etc., how challenging is that going to be to build scale?
Oh, Shireen, we just came out of a pre-series B round, about 2 months back, and despite what was happening across the world, I think we feel very grateful and very privileged to our investors that we successfully closed it, and in fact, we got oversubscribed. We've now gone into a Series B, so I've been interacting with a lot of investors in India and abroad, and I think the interest is very high because the world recognizes the need for solutions in the aged care segment. The world recognizes that this is probably the biggest blind spot, not just for the industry, but for also the tech industry. EMOHA is extremely tech oriented. The backend is very tech heavy. There is a whole approach towards creating a digital first solution, but also a care first and an elders first solution. So investors get it. Investors understand that this is, even if it is a 2,000 rupees per customer ARPU, we are talking of with just 1 million people on the app, it's a 24,000 crore market. When you add the full continuum of care within the EMOHA platform, we now have the Epoch Care Homes who operate at close to about $1,600 per month. So if you look at the full continuum, investors understand that this is a very large segment, exactly as Tara mentioned, about going to about a $15 billion opportunity. So investors understand it, but I think there is a little bit of a watch and wait that is happening, which is in some ways going to keep all the players in the industry there, that you need to keep your focus, you need to keep your eye on margins, you need to keep your eyes on customer acquisition cost, on how you are scaling it up, and at every incremental zone, how the whole cost of expansion, cost of delivery is becoming better. So I think the global investor base as well as the India investor base has started to show a lot of interest. There are a lot of single HNI investors who are putting in money, which is a great indicator despite market conditions. I think the demand side is something that is seeing increasingly an opening up. So whether it is different parts of the country where individuals are recognizing that elder care cannot be anymore a point which is ignored. A lot of blind spots in NRIs, for example, have opened up after the COVID period, where they've realized that they can't afford to just have their parents vulnerable in some part of the country. Corporates, insurance people, bank people have understood, who are now partnering with organizations like us, that there is some part of the care play that we can have an active role. To your third point about supply, I think there is innovations that is at play. Again, we don't need to reinvent the wheel. There is possibilities for utilizing a lot of talent which is there in the neighborhood. Part of the talent could be the elder itself. We have elders from 55 going up till 75, 80, who are very active, who are talented, who have time. And exactly as Neil was mentioning in what Get Set Up is doing, and brilliant work by Neil, there is possibilities of many of such kind of people being brought into the fold of routine employment for taking care of elders itself. So whether it's young people who are available, but maybe in alternate professions as gig economy, or it is elders, I think there's a full spectrum of supply also available, which can be leveraged. But it requires a lot of innovative deployment, with technology stitching the whole thing together.
Saumyajit, if I were to ask you for a wish list to leave us with, we've all spoken about the opportunity that exists, but if there was a wish list in terms of the changes that you believe need to be made, both at a policy level, at the level of government intervention to enable and facilitate the growth of this space, anything in specific that you'd like to leave us with?
Yeah, so I think the one must definitely acknowledge the fact that the last 2 years, particularly, there's a lot of activity that has happened by the Ministry of Social Justice and Empowerment. The current secretary has been extremely active, Subramaniam, for making together a lot of policy changes. But I think the one policy shift that is very important is to be able to have organizations which are in the senior care space, benefit from the kind of services they are able to do and pass on benefits to the end consumers, particularly in matters related to GST, or how we can reduce the burden that they already have. Elders across the country, as we know, they have high assets but low cash. They don't have a running income. So adding to their expenditure is not a great idea, and therefore being able to have expenditure related benefits come to them by virtue of lower tax or GST is something which is a very important aspect. Two, I think from a policy standpoint, being able to help partnerships and able to help organizations who want to do public-private partnerships across the country, whether it's in the form of senior living or assets that Tara talked about. I think it's a very important thing because across the country there is a lot of communities and assets which are there. If such kind of assets could be shared, it could be a massive advantage. We are doing a lot of programs now in Gurgaon where we are trying to see how Gurgaon can become pretty much like an elders first destination for the country. And these will require government and private sector to work very closely together. So recognizing that elders itself is a large opportunity, they are an unutilized, a great cohort that can benefit government and private sectors. I think these are small things that can play a big role from a policy standpoint.
Well, Tara, Saumyajit and Neil, thanks so much for joining us here on this special edition of Young Turks to talk about the opportunities that exist in the geriatric care space, and more importantly, the kind of products and services that will be required to ensure that as we age, we also age with dignity and joy. Tara, Saumyajit and Neil, we wish the three of you the very best of luck. Thanks so much for joining us here on Young Turks.